Uriel, first and foremost, just a big thank you for appearing on the show on such late notice. The rabbi and myself decided that, it's the first time ever that we've had a mixing of organizations. We usually dedicate it to one organization, but I'm sure that Solly wouldn't have minded. And, just where we are in the Kahila as we speak, it's absolutely imperative that Hatzolah come on to the show and address us. And, I'm hoping that this address is for the whole of the wider Kahila. So Uriel, thank you. I think it's fair to say that there are two reactions in the Kahila. The dominant reaction is that of fear. We know that there's a second wave coming. We read about the second variant, for want of a better word, of what is happening over here. No one really knows what's going on. So, there's a lot of fear, and we really need to be guided by you here, Uriel, as to what to do in the next couple of weeks, months. And then I suppose to a lesser degree, people are not respectful of where we are, and actually not really obeying by the recommendations, both by Hatzolah and by the national government. And perhaps, to those people, there's a message. So, Uriel, over to you. What message does Hatzolah want to send out to the Kahila at this point in time? And when you're giving the message, Uriel, perhaps you can just also talk about shul protocols, as well as where we are with numbers in terms of severity.
Okay. Thank you, Rob. First of all, thank you for having me on your show, and thanks to Rabbi Zolberg for hosting me and us, actually, Hatzolah in general. Let me start off by saying the following, is that the second wave is here. It's not coming, it's already here. And that's a realization that I think many people not necessarily have grasped yet. And it's a reality that people need to accept, that the second wave is here, and we need to adapt and understand that it is here. Let me start off by giving you some facts, some just numbers within the Jewish Joburg Kahila. We started 2 weeks ago on the 5th of December. It was pretty much after there was a rage party that some community members went to, and we started getting an influx of numbers from that Saturday night. 2 weeks ago, the number of new cases that we onboarded onto our COVID-19 home wellness program was 187. 135 of them were rage participants, or at least people that were associated with rage, family members, etc.
Uriel, can I just stop you there just to clarify one point? Yeah. That fact is in Joburg alone. So the kids who went on rage and isolated in Umhlanga is excluded from this number.
Okay. So yes and no. Anyone that is that lives in Joburg, even if they were isolating elsewhere, were onboarded onto the Hatzolah Joburg Wellness Program. We looked after about 12 to 18, I don't have the exact number in front of me, people that were from rage isolating in Umhlanga. Most of them had come home already and started displaying symptoms once they were here. So for the most part, they were in Joburg at that time. Very few were still in Umhlanga or wherever they were isolating. Last week, we saw a lot of people that have already recovered from, call it, the rage event. So there were a lot of people that were coming off the program. But we onboarded 96 new cases, majority not associated with rage. This week, and this week being today, we've onboarded 35 new cases. So the second wave is here, as you want to call it. I think it's very clear to us that it is here, and that this is not associated with only one super spreading event, as they called the rage event. Let me give you some other numbers. We've got a total of currently of 149 active cases that we are monitoring, with 2.5 weeks ago, we were only sitting at 20. So this is quite a big jump. Out of the 149 active cases that we're looking at, 12%, 12 patients are on home oxygen. 22 have been admitted to hospital, 15 of which are currently in hospital, both in ICU, ventilated, in normal wards, etc. And we've also got obviously a whole nursing system that if we're concerned about you, we send someone to your house, and we also, if we're really concerned, we chat to your doctor, and if we feel like we should be taking blood for some blood tests, we do that. So we've taken 49 blood tests just within the past 2.5 weeks since the 5th of December. So overall, I think we definitely on the increase in numbers. While everyone is away, we are working hard as our numbers are definitely increasing. You speak about a second wave, so let me give you some points at least from us on the second wave. I think we've identified that in most countries around the world that have already experienced a second wave, the second wave was far worse than the first wave. This is something that we've identified in most cases around the world that have already experienced a second wave. You know, I've been to a couple of functions. I'm sure you've also been to a couple of functions, and at the little bottom, almost like where the T's and C's apply, you see COVID protocols are in place. You see those words. I think now more than ever, we need to adhere to those COVID protocols. The hospitals are under immense constraint. They're really struggling, specifically in the coastal regions, but it's really coming down to Joburg as well. We are struggling. Hospitals are struggling. Beds are filling up. The second wave is, they haven't officially declared that it is more infectious. I think, as far as I'm aware, they haven't officially declared that it's more infectious than the first strain or the other strains that they've seen, but the hospitals seem that they are overburdened with patients at the moment. Young, old, no comorbidities. Yes, comorbidities really doesn't make much of a difference. Although I think the patients that are compromised have a worse effect, as far as I'm aware. But for overall, it's not really. It's a lot more infectious. Let's call it. Let's use that word.
So Uriel, it does sound and feel. Maybe I'm just bringing my own personal bias and projection over here, but it just feels a bit more scarier the second time round. Or am I just projecting?
I feel it as well. I feel like it's a little bit more. I feel like it's different. I almost feel like the first wave was a practice for us, and this is almost the real deal. That's how personally. Yes. That's how I feel. Yes. I'm more concerned for the second wave, mostly because I think people are tired of it. There's a term called COVID fatigue. And that is when people we're just over it, and we're going to have a wedding with 300 people, or we're going to have a party with, our entire family and not wear masks. And I'm over it. I'll just get it. That's the feeling that I am feeling that is around there. I mean, I'm not saying that everyone is acting like that and everyone is feeling that way, but there's definitely a sense of what we call COVID fatigue. And that's where the concern really is. Let's put it this way: Hatzolah's advice and my advice, and I reckon any healthcare professionals advice should be, is keep to the 3 basic things that we have been speaking about from day one. Wear a mask, sanitize your hands, and social distance. And if you keep that, then you should really be in a better position than if you don't. I recently gave a talk to another group of people, and I mentioned something that to many was almost a shock. And I said, if you, apart from your immediate family that you live with and live your life with, everyone else, if you imagine them being COVID positive or carrying the coronavirus, and you, in your brain, you think that they've got corona, and then you react accordingly. You stand 3 meters back, you try to be outside for as much as possible, you wear your mask, your hand sanitize afterwards. You should definitely be safer than if you don't do that. And that's really our bottom line advice to the community.
Yeah, I must say, Uriel, when early this afternoon when we spoke, that was the single sentence that sent shudders through the dovecot for me, that people assume everybody you come into contact with has COVID, and how you're going to protect yourself against it. That, I think, can be the takeaway message for today. Uriel, we do have a question which there's a bit of comment here, but also question, and I'd just like to go straight to the question, and that is, this is a question that does affect a heap load of us in the community. People who are coming back from hotspots, Cape Town, from Umhlanga, what happens with those coming back to Joburg? What's the advice of those coming back, and what's the advice for those receiving them?
So, look, if I take it back to the Rage super spreading event, there the National Institute of Communicable Diseases and the Department of Health issued a statement that anyone that went to that event has to quarantine for 14 days. That was a statement that was issued by them. There hasn't been a statement issued by them regarding people coming back from coastal regions or areas that have got a high, call it, infectious rate and a high level of people being, testing positive. I don't know. I don't think that we should say that everyone coming back from holiday now needs to quarantine. I don't know that. I think that there are people that are in the Department of Health that get paid a lot of money to do this research and come up with these protocols. They should be making these decisions. I think that for families that are receiving family that have been away on holiday, I think that there's basic stuff that maybe common sense should, they should do, and that is, keep a distance, wear a mask around each other, be extra safe for a couple of days after they arrive, just in case that, they are asymptomatic carriers. And I think that's for now, that's what needs to be done. I don't think that they should be quarantined.
Okay. Uriel, we don't have any other questions from our participants. So is there any final comment you'd like to communicate to our viewers before I sum up?
Sure. So you mentioned something about the shul. So I'll say that.
Yes. Is there any special protocol? You did mention the 3. People are asking, is it safe to go to shul? Is it not safe to go to shul? I think it's fair to assume that a large part of our people do go to shuls. Is there any special comment you'd like to regard with shuls in general? I'm not saying any particular shul in particular.
Yeah, I think that Professor Ephraim Kramer and the Rabbinic Association really created unbelievable protocols around shul. And I think that those protocols are intended to keep people safe. And it doesn't matter what level, strain of COVID-19 at the moment, at least, what we're seeing, I couldn't see an issue with that. The issue may come in when people are not adhering to those rules. But that's for the rabbis to almost enforce and deal with. I think if you're following protocols, there's nothing to be concerned about. Or nothing. When I say nothing, I mean to an extent, nothing.
Okay. Uriel, there is another question, and I do want to take as many questions as we can, because if one person's asking it, I'm sure that others are also asking it. What about those who've had COVID? They feel they're off the hook. Is this so that one can get COVID again?
Cool. So it's a great question, and why I say it's a great question is because there's actually no evidence to suggest that someone that has had COVID cannot get it again. There's no evidence in that yet. There's no evidence that the second strain, the second variant of COVID-19 that they've come out is different to the first. We don't know. And that's why the NICD currently and the Department of Health, their current guidelines are to quarantine if you've come into direct contact with someone that is tested positive, and there's no specific mention of it, whether you've had it before or not. My advice is you still need to quarantine for now. We don't know if you could. Look, I've personally seen a patient or two that has been reinfected. Supposedly they've had a positive test, then a negative test, then a positive test. Although it's a complicated discussion because you really need to get into the nitty-gritties of, the mapping of the disease. But we've seen people get reinfected. I think it's been publicized that people have been reinfected. Whether that's the majority or not is a discussion for another time. I think we don't actually know the answer to that, and therefore my advice is quarantine.
Wonderful. Thank you, Uriel. Uriel, before I sum up, is there any final message, final thoughts that you'd like to convey to the community?
I think
over and above what you've said.
So I think that as a community, we need to put those. Try to rest the COVID fatigue, as we call it, put it to the side and really take the strain seriously and think about other people. You may not care for yourself, but care for others. And I think here's an opportunity for our community to be a community and look out for other people. Stay safe, stay at home. If you come into contact, actually quarantine, actually stay in your home and quarantine. No need to go to Moishi's or any of the other butcheries or Pick and Pays to get your food. There's online shopping now, and if you really need help, yes, call me. I'll go do the shop for you, or I'll arrange someone for you. But really stay home and protect others. I think that's my message, protect others.
Wonderful. Uriel, thank you, and a special thank you for agreeing to appear on the show at such short notice. Just for our viewers, that when I was speaking to Uriel this afternoon, he had to put the phone down for me, take an emergency call, and then phone me back. And Uriel, I think that's just part and parcel of a day in the life of Hatzolah. It's an absolute gem. I cannot stress enough what a gem of an organization Hatzolah is, and the precious volunteers from your fundraisers, from your administration staff to the frontline soldiers like yourself. There are no words to thank you. You're giving up your time on the holiday season to you and to your families, Uriel. And a massive thank you. I know I talk on behalf of the entire Jewish community by thanking you, and I know that Rabbi Aaron Zolberg is going to thank you, but to you and to your families, a big thank you. And from a Kohen, Uriel, you and your entire team should stay safe and healthy. Hashem's brochas only.
Thank you.
Thank you. Rabbi?
A very special thank you to Uriel Rosen and to Hatzolah, not only for tonight, but for all that you do. And on a personal note, to Uriel, not only as a representative of Hatzolah, but for you as a person. Our community, I believe I speak on behalf of everyone, really appreciates all that you do and all that Hatzolah does. In relation to all of you, HaKadosh Baruch Hu should continue to bless you all and your wonderful families with much bracha and hatzlacha, that you should be able to continue to do the most important work that you do, and much, much more. Much, much more. A lot more than just that. A lot more than just that. By the way, in relation to the Beis Shul in particular, if you want to find out more about our COVID protocols, you can go to the website, thebeis.org.za/minyanim, and over there you'll find the full protocol list. That being said, I don't think it's really about whether you go to shul, you don't go to shul, whether you go to a restaurant, you don't go to a restaurant, you go to this shop, you go to that shop, you socialize or you don't socialize. I think the main point that Uriel was trying to put across, or did put across, and the main point that I'd certainly like to put across is be cautious, be mindful, be conscientious regarding what you are doing, and perhaps as importantly, how you are doing it. Please be safe. be cognizant of one another and be cognizant of who you are affecting through your behavior. We look forward to seeing each and every single one of you really soon. Keep safe and have a wonderful night.